Hi everyone, Macy here with another video on the ethics section of the INBDE. Today we will be focusing on another one of the 5 fundamental principles of ethics, which is justice. Justice is all about fairness and ensures that we treat all people fairly. This includes our patients, but also our employees, our colleagues, and all members of our community. Let's go ahead and take a look at how we can embody this ethical principle of justice as a dentist. Like I said, the main concept of justice is to treat people fairly, and this principle boils down to 2 main points. You must implement fair treatment of patients, colleagues, and society, as well as making sure you deliver dental care without prejudice. An example of a breach in justice would be canceling one patient's appointment to see another patient in that time frame who you feel is more important, such as a politician or popular athlete. This is not fair treatment to that patient who originally had that appointment. Let's talk more in depth about how we can fairly deliver dental care without prejudice. A huge part of avoiding prejudice comes into play in patient selection. As a dentist providing care, you cannot discriminate in the selection of your patients. This means we cannot discriminate based on gender, race, sexual orientation, religion, culture, or anything of that nature. This sounds pretty obvious, but it is also important to note that under the principle of justice, we also cannot discriminate against patients with disabilities or bloodborne pathogens. It is unethical to refuse to see a patient simply because they have hepatitis or HIV. In these cases, it is important to consider patient health prior to treatment, and it's always important to determine if additional skills or second opinions are necessary for treatment. You can select not to treat a patient if you think it is in the patient's best interest to see another provider. This would be in the case where you do not have the knowledge or experience necessary to provide the best care possible to the patient, and think that a specialist or another provider would serve the patient better. An example of this would be a general dentist who normally sees children referring a child to a pediatric dentist because the child has extreme behavioral issues, and you know they will benefit from a specialist trained in advanced behavioral techniques. The dentist referring the child is not breaching the principle of justice because they're acting in the best interest of the patient. A final important thing to note is that although we cannot discriminate against a patient with a bloodborne pathogen, we should not treat any patient who currently has a contagious lesion. Okay, so now that we have a general idea of justice, let's try a practice question. Example number 1, we have a male who's 35 years old. He says, "I'm here for my filling," and he has a penicillin allergy. The patient enters the operatory smelling of alcohol. What is the next step at this appointment? A, refuse treatment and future entry into the office. B, wait for the substance to wear off and proceed with treatment. C, require all future patients to report their substance use outside of the office, or D, defer the treatment and ask the patient to come substance-free. Go ahead and pause it and think about this question. The correct answer here is D, defer the treatment and ask the patient to come substance-free. We definitely don't want to treat this patient while he is under the influence of alcohol, so we do want to defer the treatment and have him come back when he is substance-free. Let's go ahead and talk about the other answer choices though. Now for A, although you can refuse treatment, and you should in this situation, not allowing future entry ever is extreme and perceived as discriminating against patients who may drink. This is against the principle of justice and is incorrect. Answer choice B, in order to treat a patient, you need informed consent. Since the patient is not of clear mind and is clearly intoxicated, it is not ethical nor reasonable to just wait it out. Additionally, this makes it seem like you are holding them in your office under the influence. However, this is not only dangerous for you and your team, but also the other patients. This is definitely not the best answer. And then C, this again seems like an extreme action. By forcing patients to disclose their drug use outside of the office is an invasion of privacy and opens the door to possible bias in patient selection. Now D, like we said, seems like the right option. This is completely okay and follows the principle of justice. Let's talk some more about the code of conduct under the ethical principle of justice, starting with emergency services. As a dentist, it is your responsibility to make appropriate arrangements for patients who contact you concerning an emergency, regardless of if they are currently an established patient at your office. This means that even if you are not their primary provider, you must help them to reasonably make arrangements for their emergency. It's perfectly acceptable as a dentist to go on vacation, but there needs to be some contact point or plan in place if one of your patients experiences an emergency while you are not in the office. It is important to note that if you do provide emergency care to a patient who is not on your record, you must return them to their primary provider after the emergency unless the patient says otherwise. The next concept under the Justice Code of Conduct is justifiable criticism, which includes the fact that you must report continued faulty dentist treatment to the proper society. The key thing here is that the criticism has to be justifiable, which means that it must have a reasonable basis. It is not your role to throw other dentists under the bus in front of the patient, even if the treatment done may be something you disagree with or would have done differently. You were not there when the treatment was done, and everything the patient is saying to you about the previous dentist or previous care may not be completely true. In cases where you suspect possible mistreatment, it is important to speak to the prior dentist to help clear up any assumptions and misunderstandings. For example, let's say a patient comes in saying their previous dentist found 5 cavities, but you only find 1. You shouldn't automatically make disparaging comments about this previous dentist, but rather explain to the patient that there may be a different approach the dentist took and communicate with that dentist to figure out why they had a different perspective. If you still suspect faulty treatment after this, you should report. Let's look at a couple more ways to honor the ethical principle of justice. In regard to testimony, dentists are allowed to provide a fair testimony in legal matters without any contingent fees. Any testimony we give has to be fair and honest, and we cannot accept payment just to testify in a way that leads to a favorable outcome for one party. And the last concept we are going to discuss under the principle of justice concerns rebates and fee splitting, which are both unethical in any dentist and third-party business dealings. Let's quickly talk about the difference between the two. Rebates are essentially refunds or price reductions that a customer receives only after they have bought the product. Fee splitting is when you provide a portion of the treatment fee collected to the person who referred you the patient. In essence, you give them the money and they refer a patient to your office. Now, this isn't just unethical between two dentists or a dentist and a specialist. It is unethical in any dentist and third-party business dealings, which can include marketing and advertising services. You can't tell a local advertising magazine that you'll give them 20% of every patient they directly refer. This would be unethical. Alright, that wraps up all the concepts that fall under justice. Let's practice with some questions. Example number 2. Which of the following actions violates the principle of justice? A. Refusing to provide treatment to a non-English speaking patient. B. Providing emergency accommodations to a patient not on file. C. Reporting a dentist with a history of faulty patient treatment. Or D. Refusing a business deal that involves fee splitting. Go ahead and pause it and think about these answers. The correct answer here is refusing to provide treatment to a non-English speaking patient. By denying service to a specific group of people, there is prejudice and bias in patient selection, which was a key concept of justice. But let's go through these other answer choices just to make sure. B. By providing emergency accommodations to a patient not on file, we actually are following the principle of justice. As a dentist, you should provide emergency accommodations even if the patient is not yours. For C, this also seems like it upholds the principle of justice. Obviously, you want to communicate and be sure of the faulty treatment, and reporting a dentist that has a history of this, it is the right thing to do. And finally, D, this would be ethical. You want to avoid all dealings with fee splitting or rebates. This was a crucial concept under the principle of justice. Example number 3, we have a male, he's 28 years old. He says, I am having severe tooth infection. I woke up in pain last night. Oxycodone is the only thing that helps with the pain. We do an emergency examination. He has not seen a dentist for 3 years. And our oral and radiographic examinations reveal multiple incipient caries, but there are no clinical or radiographic signs of odontogenic infection. If the patient is being aggressive and refuses to leave without an oxycodone prescription, which of the following is the most appropriate next step? A. Prescribe him ibuprofen and acetaminophen instead. B. Provide the prescription request immediately. C. Make emergency accommodations by calling 911. Or D. Refer them to a specialist. Go ahead and pause it and think about this question. The correct answer here would be C. Make emergency accommodations by calling 911. As a patient with an emergency, this would be the best option in this situation. You are responsible as the dentist for making arrangements even if you cannot help them, and in this case, it would be unethical to prescribe a controlled substance like oxycodone when clinically and radiographically we don't see any signs of odontogenic infection. So here we would make emergency accommodations for this patient undergoing an emergency by calling 911. Let's go through the other answer choices. A. Prescribe him ibuprofen and acetaminophen instead. Just like I said it was unethical to prescribe oxycodone, a controlled substance, when we don't see any signs of infection, it's still unethical to prescribe ibuprofen and acetaminophen even though they're not controlled substances. Without proper treatment that we need to provide for this, it's unethical to prescribe these. You cannot prescribe anything without being certain of exactly what is going on. B, for the same reason as option A, as dental providers, we're the ones responsible for making sure the prescribed medicine is necessary and effective. It's also kind of a red flag that the patient is coming in demanding oxycodone only, which is a controlled substance. And then D, refer them to a specialist. This may seem like it's a good choice, but considering this seems like an emergency to the patient, you want to make accommodations and not just usher them to the other doctor. This would still be unethical because you're just referring them out instead of treating that emergency the patient is undergoing. Example 4. In each of the following situations, a dentist can dismiss a patient except one. Which one is the exception? A, threatening behavior towards staff. B, repeated disruptive behavior towards other patients. C, patient's repeated cancellations. Or D, being the only dentist in town. Go ahead and pause it and think about these answer choices. Now, I think this one was pretty straightforward and hopefully pretty obvious to you, but the only time you cannot ethically dismiss a patient out of these answer choices would be being the only dentist in town. You have to give the patient opportunities to find other dental care. So if you're the only dentist in town, you wouldn't be able to just dismiss them for this reason. Let's go through the other answer choices. A, threatening behavior towards staff. That is definitely a valid reason to dismiss a patient. If they're threatening your staff, you should not be treating them. B, repeated disruptive behavior toward other patient. Similar thing, if they're endangering or threatening or disrupting your other patients, you should not continue to see them, and that is ethically a reason to dismiss them. Or C, even repeated cancellations. It's not threatening or disruptive behavior, but if they're repeatedly canceling appointments, then that is a valid reason to dismiss them. If you're the only dentist in town, however, that's not a valid reason to dismiss them. Example number 5. A patient comes for a second opinion after being told by their previous dentist that they need 6 fillings. Upon clinical examination, you determine that the patient only has incipient occlusal caries. What should you do? A, tell the patient to report the other dentist. B, refer the patient back to the previous dentist. C, explain to the patient that there are different opinions among dentist diagnoses and treatments. Or D, suggest the patient seek a third option. Go ahead and pause it and think about these answer choices. The correct answer here would be C, explain to the patient that there are different opinions among dentist diagnoses and treatments. And the explanation for this is that it is important to maintain professional integrity and avoid making derogatory comments about another dentist. By explaining to the patient that there can be different opinions among dentists, you acknowledge the variability in diagnoses and treatment plans. You should then proceed to diagnose and treat the incipient caries based on your clinical examination. You do not have to treat based off of what the previous dentist said, only treat based on what you find. This approach maintains professionalism, provides clarity to the patient, and ensures they receive the appropriate care based on your findings. Keep in mind, this is not considered justifiable criticism because this isn't something you are repeatedly noticing from a particular dentist. And also, you don't know what may have led the previous dentist to that diagnosis. In this case, I would still encourage you to reach out to the other provider in this scenario to discuss why they believe the patient in question needs 6 fillings. Before we end the video, let's do a quick recap of what we went over concerning justice. Under this ethical principle, we have to treat people fairly. We know it is unethical to discriminate when selecting patients. We as the dentist must make accommodations for any patient during an emergency. And rebates and fee splitting are unethical. Alright guys, that is it for today's topic. Thanks for watching and see you next time.